Dr. Bannet Ndyanabangi is the Vice President of Global Programmes at the non-profit village Reach and joins us now from Kampala in Uganda. Good to have you with us on the programme. Could you give us your perspective of whether you think Mpox is becoming as problematic as potentially COVID was?
Well, thanks, Sahel, for having me. The similarities really is that they are both viruses, and obviously Mpox is also spread from human to human. Their origins are all both from animals, but then the difference is that Mpox is spread more through contact. In other words, mucus, fluids, whereas COVID was more of a respiratory infection disease. But obviously, we are still studying the virus to know whether it can also be spread by respiratory infection.
Yeah.
But obviously, the fact that it is spreading from human to human means it is mutating and therefore can spread widely. And therefore, we need really to take similar precautions. We need to set up systems to respond to this virus the way we did for COVID.
Indeed. And we've been speaking to many analysts and many doctors and many health professionals over the past few days when it comes to Mpox. So in terms of the precautions that are being put in place in countries across sort of Central Africa, what's your general impression as to the WHO's conclusion that they are in control of the situation? What's your observation?
Well, the countries I'm aware of, my organization works actually in DRC, works in Malawi and Mozambique and many other African countries. I think the lessons that have been learned from COVID, the infrastructure that has been set up is a blessing because many countries have already activated what we call incident management systems or systems to respond to such epidemics. So we are in a better place, definitely, because systems have been put in place. Many countries are able to carry out tests because equipment was brought in and tests can be carried out to ensure that we test, then we can trace where the disease is, and then we can respond accordingly, either with treatment or isolation, and ensure that really the response is adequate. Obviously, there are challenges because as with COVID, we are again seeing the issue of vaccines not being readily available. And we need really international solidarity to ensure that at this time, the vaccines are readily available for Mpox. They are there, but they are not enough. I think Africa needs right now about 10 million. We are talking about having only about 200,000. So on the vaccine front, we need more solidarity. On preparedness and response, I think we're in a better place.
Yeah, we'll see certainly what does happen. I think that's the general gist we're getting from the WHO as well. Bannet Ndyanabangi, thank you for joining us.